Good day. Welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabere Schuster, State Director of AARP in this territory. And today we have a very interesting program about an initiative of the administration of Governor Albert Bryan Jr., called Healthy Horizons. And so we have with us today a special guest who is Dr. Julia Sheen to speak with us about this initiative and give us some more details. So good day, Julia. Dr. Sheen, how are you?
Greetings, Mr. Schuster. Thank you so much for having me, and thank you to the viewing and listening audience. I am great. I hope you're I hope you're doing well.
I am, and my family is too. And thanks for being with us here today and spending time with us to discuss this wonderful initiative. So before we start, tell us a little bit about your role now with the government of the Virgin Islands and previous hats you wore with the government.
Well, as you mentioned, I'm now currently serving as the Governor's Policy Advisor on Health and Human Services. And I'd like to describe that role in 4 categories. The first of which is I serve as a liaison to the Departments of Health and Human Services, as well as Veterans Affairs. I also lead special projects on behalf of the governor and leading the Telehealth Initiative as well as the Healthy Housing Initiative. I also take a lead role in developing major policy as well as pieces of legislation like the Telehealth Act that we're going to talk about later on. And then finally, I think my role also includes sort of an administrative function where I help to solve problems and provide strategic vision as it relates to public health and healthcare. In terms of my previous hats, I was once a deputy director within the Bureau of Primary Healthcare on a federal level. Our bureau oversaw all of the health centers across the nation. And so I worked with Health Resources and Services Administration for about 7 years before coming back home. And prior to that, I was the Commissioner of Health under the Diem administration.
Great. And that national role that you played, that was in Washington, D.C.?
It was in the Rockville area, yes.
Rockville, Maryland, right?
Yes, Rockville, Maryland.
Okay, excellent. So you're well steeped in public health.
I am.
A world of experience and information with you.
Not only steeped, but it is my passion, and I would say my mission.
Yes. Well, so important. I mean, health goes right to life. I mean, without healthcare, without public health, I mean, we see the pandemic going on right now. I mean, without public health, we all perish. So thank you for your dedication to that and your dedication to not only the whole United States, but especially the people of the Virgin Islands.
Thank you.
And we're proud to have you as a Crucian, right? You're a Crucian.
Definitely, and my parents are as well.
Right. Excellent. So again, Governor Bryan has recently announced the Healthier Horizons initiative to the people of the Virgin Islands as a mechanism to reform healthcare in the territory. Under this plan, the government of the Virgin Islands has adopted 11 elements or developed 11 elements. Can you tell us a little bit about each of these elements?
So I'd like to just list them because they're so, I would say, comprehensive. And we're going to talk later on about the show that I am hosting called One Health VI, where I am going to be going into sort of a conversation about each of the initiatives, but I'd like to list them for now. And they include the Behavioral Health and Developmental Disabilities Act, the Health Information Exchange, the Telehealth Act, the Medical Compacts, and it's actually the Interstate Compacts. We also have the Virgin Islands Fire Service and EMS merger that I'm sure you're very familiar with, the VI, the Emergency Medical Services Regulation, the Healthy Housing Initiative, the Association Health Plans, our hospital renovations, the infrastructure of our hospital facilities, as well as the territorial health plan. What we used to call it is called now the community improvement process or plan that the Department of Health is leading. And then finally, medical cannabis. I think it'll take us much more than a half an hour to go through every single initiative. So more to come on those as we have the taping of our One Healthy Eye show.
Excellent. And AARP is very pleased to partner with the government of the Virgin Islands on several of these initiatives, especially healthy housing initiative and
Yes.
telehealth, among others. This is a wonderful initiative, and will certainly go a long way to improve healthcare in the Virgin Islands. So, we need not only organizations like AARP, but the entire community behind this to make this work, to bring about a positive change for all of us, because we're in a little group of islands surrounded by a lot of water. Like I always remind people, you can't just have a helicopter pick you up off the street when you've been in a serious car accident and take you to Miami. We have to rely on our hospitals, on our healthcare providers here, in order to even be able to get off island. But most importantly, why do we even want to get off island?
Yes.
We should have excellent healthcare here so that we never have to leave.
Well, that's the whole purpose of the initiative, Governor. We are all working towards that.
Yes, absolutely. Excellent. And so, what is the timeline associated with this initiative, all of these 11 elements? Like, when do you think that all of this could be substantially complete?
Well, it's hard to give a timeline for all of the initiatives because they're so very different. And so they all have varying timelines. For example, the Behavioral Health and Developmental Disabilities Act was already forwarded to the legislature. And so we're just now waiting for the legislature to hear that piece of legislation. So that's completed. The Health Information Exchange, for example, we are about to put out for solicitation the Health Information Exchange Project Management solicitation. So that's going to be going out within the next 2 weeks. And we're currently developing the Health Information Exchange RFP. So all of them are in different phases. The Telehealth Act is in its final phase, and we will be sending that to the legislature within the coming weeks. So all of them have varying timelines.
Okay, understood. Access to healthcare strengthens communities. How is Healthier Horizons going to create a sense of inclusion for all residents, regardless of their social status, when the access to quality of care is often limited due to lack of services and affordable care?
Well, first of all, in terms of inclusion, let's address that first. All of the varying initiatives, we have been very strategic in making sure that we have included not only consumers, our public and private providers, government agencies, nonprofits, in providing feedback and commentary on all of the initiatives, or they serve in a work group or some sort of a coalition or steering committee that we've established to guide a lot of the initiative and activities related to each of them. So that's how we've included folks. If you go on our website, and we'll be talking about that later on, you'll find a summary of each of these initiatives. We have implemented a strategy now where we are asking the community to comment on various pieces of legislation. We don't ever draft anything without involving the persons that are going to be impacted the most by our work. So we're always constantly bringing people to the table and involving them as we develop these initiatives. So we've been very inclusive of involving persons regardless of their socioeconomic status.
Excellent. That's very important. But personally, I'm always very concerned, and I'm sure that you all have this group at the table also, the indigent, those who cannot afford to pay for an air ambulance to get off this island. There's so many people who just have to rely on the healthcare here in the Virgin Islands. And,
Yes.
and my heart always goes out to those people. I mean, thankfully, I have the ability to leave if I have to and get healthcare outside of the territory. But many, many, many people are just solely reliant on this healthcare system. So, I hope that it brings great help to all of us, but especially to that group of people who needs it the most vulnerable group among us.
Definitely. I know the governor is very passionate about serving vulnerable populations. And we see that with our healthy housing initiative, for example, where the governor wanted us to develop a plan for how we're going to serve vulnerable population and not only providing them with health services, but we're marrying health and housing. And so we're currently conducting a housing and services inventory to determine what types of services we provide, where the gaps exist, to determine how we measure quality of those services, and to come up with a comprehensive housing and healthcare services plan for vulnerable populations in the Virgin Islands. And we're specifically targeting 4 areas. We're looking at youth, we're looking at supportive housing, and that would serve persons who are disabled as well as those who are homeless. We're looking at our seniors because we know we don't have skilled nursing home services in the Virgin Islands. And so that's a priority for the governor moving forward. And then, of course, last but never least, we're looking at behavioral health services. And so we hope to use this information to design our health and housing services in those 4 areas that I mentioned.
Excellent, excellent. Inspirational. Thank you for doing all of this great work, this great body of work. Now, as the novel coronavirus pandemic continues to stretch the healthcare systems of the world to the brink of near collapse, uh, COVID-19 has exposed us to a lack of alternative systems that can monitor and treat patients during a crisis. Telehealth provides such an option. Despite the fact that a Telemedicine Act exists in the Virgin Islands, the use of telemedicine has remained relatively slow to adapt in the USVI. Please define for us what is the telehealth and opportunities it offers to patients and their access to ongoing interrupted care.
Okay. So what I want to do first is to define telehealth. So, and in a very basic way, and I'm not using the definition that's in legislation because it's kind of long-winded, but telehealth is really the use of telecommunications to provide healthcare services, to promote health education, or to facilitate health administration, public health and health administration. So I also want to bring a distinction between telemedicine and telehealth. So the telemedicine legislation only speaks to physicians. The Telehealth Act broadens that definition to include all healthcare providers. And that's really important when you consider things like social workers and other behavioral health workers that might need to use the technology to see patients. And so that's really important. What the Telehealth Act does is it provides the legal authority for telehealth providers to see patients using technology. It also protects patients because it requires all telehealth providers to have medical malpractice insurance or liability insurance. It also defines how you should diagnose a patient using telehealth. So we are, in doing that, protecting our patients. And like you said, telehealth is new. It's become popular because of COVID. But the governor's vision is to make sure that telehealth is incorporated or integrated into the healthcare system in the Virgin Islands.
Okay. So we do have a telemedicine act, but now we're moving into a telehealth act, which is
Yes,
more comprehensive.
it is. It is. We've actually expanded that legislation and we're folding it into the Telehealth Act. So there will no longer be a telemedicine legislation. It would just be telehealth.
Okay, that's interesting.
Yes.
That's an important distinction because even though I myself have heard these terms over and over and over and over again, it seems like there's always some bit of confusion in my mind as to what the difference is.
Yes. Yes.
So now we're taking it the next step, and we look forward to having this enacted so
Yes.
that we can make even better use of telemedicine slash telehealth all
And
around.
and once again, I wanted to make sure that it's clear that telemedicine is reserved for the practice of medicine by physicians and other clinical providers. But telehealth is much broader because it includes other healthcare providers that might not be physicians. So that's really important. And we wanted to, and in doing so, we're actually expanding access to care by opening it up to all healthcare providers. I think that's really critical.
Excellent.
Yes.
My mother's physician here on St. Croix, I will not name the practice because we never
Yes.
promote for-profit organizations, being a
Sure.
non-profit organization ourselves.
Mhm.
But he has this telemedicine setup. So at home, she has a wireless blood pressure monitor, blood pressure cuff, all digital, and then a pulse oximeter, and it links by Bluetooth to a little box, about like half of the size of your
Mhm.
smartphone. So every time we take her blood pressure, it links to that box, and through the cellular network or through Wi-Fi, depending on where it's located, it will send the data to her physician. And then, if there's an emergency, she can or I can push a little button on that little box, and we will initiate a call to our healthcare provider, whether an audio or even a video call, because there's a little tiny little camera on it, and the whole monitor becomes, the video screen, as it were, and and it really, 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 really helps because the doctor has a daily record of her blood pressure, of her oxygen saturation, etc., her pulse. And if we need, we can always reach. So, like one evening, her blood pressure dropped a little bit low, and we were very concerned. The physician's office was closed, but we pushed that little button and we got his nurse online instantly. And she was able to offer suggestions as to how to increase her blood pressure to get it back into the normal range, et cetera. So it's a really wonderful thing on so many levels. For regular doctor's visits when you can't leave your home, especially during a pandemic, or if you're sick and shut in, and it's hard for your family to get you to the physician's office. It's great for evening time, nighttime, when there are emergencies. You can get to your healthcare provider immediately. So I really support this wholeheartedly.
I'm so glad you mentioned that because you raised two issues for me. What you're describing is remote patient monitoring, and that's actually included in the telehealth legislation. But two, I think it's so important for our community to understand how it's going to help them. We talk about addressing the social determinants of health, and all that is addressing all of the social issues that would prevent someone from accessing health care, transportation being one of them. There are seniors in our community that don't have transportation. Telehealth provides a wonderful solution for them to have consultation with their providers from the comfort of their living room. And so I'm hoping that with the passage of this legislation, as well as us promoting the use of telehealth, that providers and patients will use the technology, whether it's on their cell phone or a laptop or a tablet. Some providers are actually even providing tablets to their patients so that they'll have access just in case they don't have computers in their home. And with COVID, we found where doctors are now having communication via telephone.
Excellent. Yes, it's very, very helpful. I can attest to that. So, with the latest effort to expand access to care through telemedicine, how is the government of the Virgin Islands ensuring that protection of patient information is at the forefront of this delivery mode of healthcare?
Well, I will say that we take protecting a patient's privacy and, in particular, the information very seriously. What we are doing is with the health information exchange, we are developing legislation that will specifically include language that speaks to patient privacy and how we're going to handle that as a government. And so that's how we're doing it in legislation.
Okay, excellent. Because you and I both know about HIPAA very well.
Yes,
You know,
correct.
I can never get that straight. Is it Health Insurance Privacy and Portability Act?
Portability Act, yes.
Yes. Okay, I got it right this time. And that's a federal set of guidelines about patient confidentiality, about privacy.
Yes,
Um, all too often here in the Virgin Islands, like in any other small community, it's not upheld. It's not practiced properly.
yes.
So, I really, really hope that through even local legislation, you all can tighten up the reins even more and make sure that the patient's information is kept confidential.
Yes, we're actually going to have language that applies to HIPAA within our local legislation so that we'll have sort of a local application of HIPAA here in the territory. And so that's going to be included in that piece, the HIE legislation as well.
Excellent. Excellent. Now, as we're coming down the home stretch of this show, what are other ideas that you want to share with us? Other thoughts, other interesting information about the Telehealth Act?
Well, certainly we want to promote the use of telehealth. Another piece that's really important to all of this, we are working with our federal partners as well as National Governors Association to develop a telehealth workforce development plan because we are getting ready to launch the health information exchange here in the territory. That's a $14.9 million investment. And we have a very small handful of persons trained in technology, but not necessarily trained in health information technology. So we need folks that are trained in privacy and security in a number of areas that are related to the stand-up of our health information exchange to support our providers in their use of telehealth. And so that's important that we not only train our current staff, but that we train up the pipeline, the younger generation that's coming up. So we need to be looking at certificate training programs. So we are going to be working with the University of the Virgin Islands in a university partner on the mainland to develop some certificate trainings for our local staff, persons, whether they're already in the field or they graduate out of high school and they want to get into health information technology, which is huge on the mainland. So we're going to be focusing on that. So that's one piece. The second piece is that we've launched a telehealth provider survey. We launched that on October the 12th, and it's going to be finalized on November the 2nd. And we're asking all of our providers to take the survey. It provides us with an opportunity to assess how many providers are using telehealth. What are their needs? What are their technology needs? Where are the gaps? Where are the barriers in using the technology? As well as what are their staffing concerns? Because you could imagine you have some small practices that might not have access to that subject matter expertise. So we need to know where we need to provide that kind of support so we can develop a plan to better assist them. So I'm encouraging all of our providers to please take that survey. It's really important. And then when the legislation goes before the Senate, I'm asking all of the community and the providers to come out and support it as well. It not only it increases access to care for our patients, but it also, it really protects our patients as well.
Excellent, excellent. And I like especially what you said about developing certificate programs on the mainland for some of our local residents. And that fits in so well with Governor Bryan's initiative of workforce development.
That's right.
You
That's
know,
correct. That's
we
correct.
we always talk about like different trades and so forth, which are very important, right?
Yeah.
We all need electricians, we all need plumbers, we all need masons, people who do construction work, etc. But at the same time, the global workforce is becoming much more technologically advanced, if you will.
Very
And so
much
it's a
so.
great opportunity for
Yes,
our residents to even go on the global scale with this kind of training.
definitely. Yes. Yes.
Now,
We're really excited about it.
for sure. And the big thing is to make sure that we keep them here once they're trained, right? We need them to
Yes.
stay here,
Yes.
stay home, stay in the Virgin Islands.
It's so important because a lot of these services are being outsourced because we don't have the capacity here. And so we need to start training up our local workforce so that they can fill some of these needs. It's really important.
Absolutely. Now, how can the public learn more about the Healthy Horizons initiative? Where can they go to find this information?
Well, we have a website. It's www.vi.gov/healthier-horizons. Once again, that's www.vi.gov/healthier-horizons. And that's the best way. We have a summary of all of the initiatives on the website. And in addition to that, we recently launched a new show called One Health VI. It tapes every Wednesday and airs every Tuesday. So we're actually going to be airing it again on the Government Access channel, and it's going to be aired on Facebook as well. It's pre-recorded. So we are going to be talking a lot about the Healthy Horizons initiatives. And the next conversation is going to focus on our hospitals and the renovation projects. So, you know, I'm very excited about that. And everybody wants to know what's going on with the hospitals, what's the timeline, where we are, and to find out a little bit more about the design and build out. And the governor just had a press release recently that talked about the approval of the architectural and engineering design contracts that were recently awarded. So I'm looking forward to having those conversations.
Yeah, and we look forward to that too. Well, we're just out of time. Dr. Sheen, Dr. Julia Sheen, thank you so much for being with us today. Thank you for bringing us this important information, and we look forward to having you on future shows here at In Conversations with AARP in the Virgin Islands.
Thank you so much for having me, and thank you to the listening and viewing audience.
Bye-bye.